Diarrhea is one of the most common clinical problems, but also one of the most misunderstood. And unless you approach it systematically, you can easily miss serious pathologies. So, what exactly is diarrhea? Clinically, it is defined as the passage of loose or watery stools or stool weight more than 250 grams per day. Now, globally, this is not just a symptom, it is the second leading cause of death in children under 5 years, making it a major public health concern. The first step in understanding diarrhea is classification based on the duration. Acute diarrhea goes on for less than 14 days. It is most commonly infectious and usually self limiting. Management mainly focuses on hydration. Persistent diarrhea, it goes on for 14 to 30 days. This may indicate unresolved infection or post infectious malabsorption. Chronic diarrhea, it goes for more than 30 days. This is often non infectious but requires thorough evaluation. But classification is not enough. To truly understand diarrhea, we need to understand its mechanism, that is, the pathophysiology. Almost all diarrhea can be explained by four fundamental mechanisms. First, secretory diarrhea. Here, the intestines actively secrete electrolytes and water even when the patient is fasting. This is typically seen in infections like cholera. So, the problem here is excessive secretion. Second, osmotic diarrhea. Here, non absorbed substances remain in the intestine and draw water into the lumen. Classic example is lactose intolerance. And importantly, this improves with fasting. Third, inflammatory diarrhea. Here, the intestinal mucosa is damaged, leading to leakage of fluid, protein, and blood. Commonly seen in IBD, that is inflammatory bowel disease, or other invasive infections. Here, the problem is the mucosal injury. And finally, motility-related diarrhea, where intestinal transit is too rapid, reducing time for absorption, commonly seen in IBS. Here, the issue is speed, the transit. So remember, secretion, osmotic pull, inflammation, and rapid transit. These four mechanisms explain most of diarrhea. Now, once you understand the mechanism, next step is clinical assessment. Start with the duration and onset, which we have discussed. Second, the stool character. This assesses the stool characteristics like frequency, volume, blood, or mucus. Symptoms. Look for associated symptoms: fever, vomiting, abdominal pain, weight loss. Exposure. Exposure history is crucial. Travel, food, contact, it is very important. Now, past history. Considering underlying disease, medications, or immunity is essential in the clinical assessment. Examination, it mainly focuses to check the hydration levels, to check skin turgor, mucosa, pulse, blood pressure. Also, assess abdomen and systemic features. The diagnostic approach and the investigations. So, most acute diarrhea, they do not need investigation, but look for red flags: blood in stool, severe dehydration, persistent symptoms. Investigations. So, it includes stool tests, blood tests, which I have mentioned. In chronic cases, they may require colonoscopy, imaging, or even a referral. Investigate when there is dehydration, there is blood in stools, or prolonged symptoms, and always investigate high risk patients. So remember, diarrhea is not just a symptom. Classify it, understand the mechanism, the pathophysiology, assess it clinically, and investigate only when necessary. Thank you.